But I'm going to tell you, reversing diabetes is much more psychological than it is physiological. Your battle with diabetes will largely be won or lost in your mind. If it were only the physical side of diabetes that we had to deal with, heavens, we could have diabetes wiped out tomorrow morning. But it's not. It's much more complex than that. It's complex because you've allowed yourself to believe these myths that are leaving you largely helpless and out of control. I want to try to help you understand how to get that control back. You know, diabetes, we talk about how severe diabetes is. It reminds me of a movie years ago, decades ago actually, called The Terminator. Some of you probably saw it with Arnold Schwarzenegger. And here's Lieutenant Reese, or Kyle Reese, comes back in time to protect Sarah Connor against the Terminator, played by Arnold Schwarzenegger. And at one stage, they're in a car, they're trying to get away from the Terminator. Sarah Connor doesn't know who Reese is, so she tries to jump out of the car. He grabs hold of her shirt, holds her in the car, and she sinks her teeth into his hand. You maybe remember this scene. And Reese says, "Listen, cyborgs don't feel pain, but I do. Don't do that again." Sarah says, "Just let me go." And Reese says, "Listen and understand. The Terminator is out there. It can't be bargained with. It can't be reasoned with. It doesn't feel pity or pain or remorse, and it absolutely will not stop until you are dead." Pretty dramatic scene. Well, that's what diabetes is. Diabetes is a Terminator. Doesn't care who you are, where you live, what you do, how many kids you have. Diabetes has only one goal in mind: to take you out as quickly as it can. So get that through your head. This is a Terminator, and it works like a runaway freight train. You say, "Well, maybe I'm going to have to do something about this." Well, yeah, you will. Not tomorrow, not next week, because you see, it will never be easier to stop or to slow and stop this freight train than today, because tomorrow it's going to be harder, and the day after that, and the day after that. I want you to listen to a phrase that I tell people over and over again. Healthy people do healthy things. Now, generally, that's not 100% true all the time, but most of the time it is. Healthy people do healthy things. Okay? So you've got to get this done. It is more psychological than physiological. So make the decision in your mind to step in, to intervene, to make some changes so we can reverse this. It's very similar. Again, I'm reminded of an old movie decades ago, Star Wars. I mean, heavens, it illustrates this beautifully. Here you have Luke, right, who goes to a different planet. He needs to learn to use the Force to become a Jedi Master. And of course, Yoda is there. And he lands and his spaceship sinks into a swamp. And he wants to, after his training, he wants to leave. So he's trying to use the Force to bring his ship out of the swamp, and he's trying hard and concentrating, and it comes up, and then it fails, and he sinks back down. And Luke falls on the ground, and he says, "Oh, we'll never get it out." And Yoda says something like, "Why are you always so certain? You know, why is it with you that it always can't be done? Don't you understand anything I'm trying to tell you?" And Luke says, "Master, look, moving stones around is one thing, but this is totally different." Yoda says, "No, it's no different. The only difference is in your mind." Luke says, "All right, I'll give it a try." And Yoda says, "No, try not. Do or do not. There is no try." Exactly the same situation here. Look, you've got no choice. You keep doing what you're doing and suffer the fate of every other diabetic that's involved in traditional American so-called health care, or you get a grip of reality, throw these myths out the window, understand that you can affect this, make the decision to change it, and make a real life for yourself. Okay, let's lay some foundation. You need a basic understanding of what diabetes is, and let me spend just a few minutes here because this is crucial to understand. Diabetes is broken up largely into 5 stages. Stage 1. Stage 1 diabetes starts for most Americans in our late teens, early 20s. Yes, that early. Stage 1 by most people is simply called insulin resistance. And, you know, no big deal. Everybody's got some insulin resistance. Well, it is a big deal because that is the onset of diabetes. And it begins very early on. We don't know it at the time because our body simply compensates for that. And that's what leads to stage 2. But before we leave stage 1, we need to understand stage 1 is characterized by low blood insulin, and we'll talk more about insulin in just a minute, and low blood glucose. So this is all subclinical. We don't know that stage 1 has even occurred. Stage 1 usually very quickly gives way to stage 2. This is when the body, sensing the insulin resistance that's building, calls upon the pancreas to produce more insulin to compensate for that insulin resistance. And again, this occurs without us even being aware of it. Well, while that's a good thing in that it keeps our blood glucose normal and low, unfortunately that means we have an ever-increasing level of insulin in our bloodstream. Now insulin, most people think of insulin as a good hormone, and it is for what it's designed to do. But like almost every hormone and every other thing in our body, too much of one thing can lead to some very damaging effects, and nothing is more true with that concept than what happens with insulin. Because you see, insulin, when present in the bloodstream in too high quantities for too long a period of time, triggers what we call the inflammatory response mechanism. And inflammation is at the foundation of almost all of the so-called lifestyle diseases that are affecting Americans and in the entire Western world. Atherosclerosis, heart disease, hypertension, even cancers are linked into this. So the foundation of many of those things, when traced back, goes back through the inflammatory response mechanism, and we ask ourselves, what caused that? What triggered that? Well, elevated insulin levels, or hyperinsulinemia as it's called, is what triggers inflammation response. Stage 2 is characterized, therefore, by a rising blood insulin level as the pancreas produces more insulin to offset the insulin resistance that's building through this period, but our blood glucose is still very low. The pancreas is able to keep it in check with higher levels of insulin. Stage 3 gives way to stage 3. And I tell people, here's where the honeymoon ends. Stage 3 occurs when you go to your doctor's office for whatever reason. Maybe it's a regular physical or whatever. You get a fasting glucose, or he takes an A1C or a glucose challenge, and woe and behold, your glucose is elevated, and doctor says, gee, you're diabetic or pre-diabetic. That's stage 3. Stage 3 is what happens when your pancreas can no longer keep up its increasing production of insulin to offset the rising insulin resistance that has been building through stages 1 and 2. In other words, your pancreas has finally reached 100% of its insulin production, can produce no more. Yet insulin resistance continues to build. So it's only a matter of time before the insulin resistance overtakes even this excess amount of insulin and can no longer keep your blood glucose in check. So now for the first time, blood glucose begins to rise above normal. And stage 2 will usually take 10, 20, or even 30 years or more to manifest. So you think that you're perfectly healthy, you don't have diabetes, that's for other people, your blood glucose is normal, so you've got nothing to worry about, right? Wrong. Because for 20 or 30 years, your body has experienced very high levels of blood insulin. Inflammatory response has been triggered. Inflammation sets in all over your body, wreaking havoc in more places than we can list just now. Stage 3 is when things really begin to accelerate because you're experiencing all of the damaging effects with blood insulin, high blood insulin, and something I didn't even mention. Listen, insulin is an anabolic hormone. That simply means that it's a tissue-building hormone. In this case, it wants to build fatty tissue. That's why it's called the fat storage hormone. I mean, have you ever wondered why through your decades of your 30s, 40s, into your 50s, you have such a difficult time maintaining that college weight? Most Americans pick up an average of half a pound or more per year through the decade of their 30s, 40s, into their 50s. Why is that? That's not just middle age. That's not just getting older or normal. No, this is diabetes playing with your body, and it's not a very fun game. So stage 3 is when the honeymoon's over. Now you begin to get rising blood glucose for the first time. Stage 3 gives way to stage 4 if nothing is changed. And this is where it begins to get very, very serious. Stage 4 is where we see the serious effects of diabetes. We get vision loss, we get severe numbness, tingling in the limbs. Many times that can lead to injuries that have difficulty healing. We may get compromised liver, kidney function. Things get pretty serious because now you know you're in a battle. You feel it every day and it gets worse constantly. Stage 4 is characterized by a lowering blood insulin level, and you're asking yourself, how in the world or why in the world is that happening? We need insulin more than ever. Well, that may be true, but your pancreas has been producing insulin at 100% production for so long, it finally begins to break down. We call that pancreatic exhaustion. So now, in stage 4, you're into the early stages of pancreatic exhaustion, and we no longer have that tremendous level of production of insulin that we had in stage 2 and 3. And so we have blood insulin or production of insulin falling off rapidly. So right at the time when insulin resistance is at its highest and your glucose is starting to rise like crazy, you have very little insulin to combat it. As a result, your blood glucose goes very high, many times 300-400 milligrams per deciliter or even higher in stage 4. If nothing changes, it leads to stage 5. Late stage 5 is where the freight train crashes and burns. This is where we get the amputations, blindness, kidney failure, dialysis, and you've got a few years left before death, and it's not very pretty. Stage 5 is characterized by low blood insulin. The pancreas is literally incapable of producing insulin and very, very high blood glucose. So understand these 5 stages of diabetes. I get calls and people tell me all the time, oh, Ken, I've only been recently diagnosed with diabetes just last week or last month at my doctor's office. So I haven't got, I need to change a few things. I say, yeah, you do. But guess what? You've had diabetes for probably 30 to 35 years. Really? Yeah, really. And the damaging effects of diabetes have been wreaking havoc in your body for a long, long time. People need to understand that diabetes is a foundational disorder. Once insulin resistance starts and we get increasing insulin or hyperinsulinemia in the bloodstream, the stage is set for all of the so-called metabolic syndrome symptoms that we're familiar with, including elevated cholesterol, triglycerides, blood pressure, weight gain. All of these things begin to happen. In fact, decades ago, 40 to 50 years ago, most medical doctors understood these signs, elevated cholesterol, triglycerides, high blood pressure, to be merely symptoms of diabetes. And that's very, very correct.